Welcome to the program. I'm your host, Neil Howard, on Health Professional Radio. In this segment, we're going to have a conversation with Dr. Tracy Todd. He's joining us here as CEO of the American Association for Marriage and Family Therapy. He's going to discuss the recently launched new Decade in Review special issue of the Journal of Marital and Family Therapy. It's a once-in-a-decade review, and this is the journal's fourth special issue. Welcome to Health Professional Radio, Dr. Tracy Todd. Thank you for joining us.
Thank you so very much for having me. This is really nice and I appreciate it.
Tell us a bit about yourself and about the association, the American Association for Marriage and Family Therapy.
Okay. Well, about myself, I actually got my PhD in marriage and family therapy many years ago and spent about 20 years in private practice actually seeing clients before I ventured into AMFT and became an association manager. So I have experience on both sides of the fence, if you will, of actually seeing the clients, working with clients of all different sort of populations and clinical diagnoses, and now helping the association and our members be able to work with those clients also. As you may know, the American Association for Marriage and Family Therapy basically represents the professional interests of about 80,000 marriage and family therapists throughout the world, including the United States, Canada, and we have a number of now MFTs that have been trained in the United States and then go back to their countries of origin or travel abroad and start to launch careers in other places. So it's getting to be a little bit bigger than American now, but predominantly it is still a domestic association in the United States. One of the things that we take pride in is our mission, and that is recognizing that relationships are fundamental to the health and well-being of individuals, couples, families, and communities. And we work really hard to advance the practice and the profession so that individuals, couples, families, and communities can benefit. Because we all know that individuals, couples, families, the stronger they are, the stronger the community is. One of the things that we do is what you mentioned about the special issue of the JMFT is for our members is we have a scientific journal, the Journal of Marital and Family Therapy. And every 10 years, we create a Decade in Review. It's a major undertaking. And this year, the editor and the authors did an exemplary job. And it was really great because, as I said, I've been in the field for a long time, and I've seen these Decade reviews. And just to see the level of sophistication in the research that was done to synthesize all of the research out there, but also the research that is out there. Boy, when I started, it wasn't that way, and now I'm really happy to see how we have advanced, really happy.
Now, this Journal of Marital and Family Therapy, this is not something that just comes out once a decade. This is a regular journal, but this is a special Decade in Review issue, correct?
That is correct. This is a regular journal, comes out every couple of months, and the Decade Review, this will be our fourth one. And so we've covered, a number of years now, going on 40 years. And it is something special that the membership, especially our academics who teach at universities, this is something that's really beneficial to them because they can have something tangible to give to the students. It's also something tangible for our clinicians out in the field to be able to read and be able to learn about and to know what the trends are and what's coming up. So it is something that really benefits everybody.
This 10-year Decade in Review covered, I believe, mental health issues. Is that correct?
That's correct.
What specific mental health issues were covered in this Decade in Review issue?
There was a wide range this one, and it was nice because they made sure that the editor and the authors made sure to include from early childhood all the way through adulthood. So, we had infant and early childhood mental health issues. We had attention deficit, anxiety, mood disorders, substance abuse, suicide, violence, couples relationships, and regular health conditions also, and how they impact family and how they, if you will, demonstrate themselves clinically. So there was about 13 articles, and the first 12 were on couple and family interventions as they were related to mental health and behavioral health disorders. The final one, though, was a different one, and the 13th article, which was something that I was particularly proud of. And that one was an article that reviewed the past decade of research And its goal was assessing the progress and identifying areas where advances in research were needed to decrease mental health disparities among racially and ethnically diverse populations. And that one there was, I felt, spectacular because all of the clinical issues are relevant to the folks that are oftentimes marginalized, the diverse populations, those that don't have access to care. So this here really was a nice article to say, where do we stand and what have we gained over the past 10 years?
Was that particular part of the review a response to many of the disparities that the pandemic has shed light on, many of which some of us knew existed already, but many had no clue existed? Was it in response to that climate, or has this been something that the association has been planning to look into or has been looking into for some time?
Well, I think for our academics and the researchers, it has been something that has been there for some time because it does relate to how you go about, seeking grants and research monies and funding and things like that. So it has been on the radar for quite some time. I think the pandemic, for better or worse, really just put the magnifying glass on this topic, which really elevated it in its importance with this issue.
Well, what should practitioners and clinicians take away from this special issue? What's the biggest takeaways from this decade in review that you feel are important?
Well, I think the first one really does tie back to this article about disparities, because even at the end of the day, when we look at all the research that was conducted, I mean, they had over 271 different studies were captured. Only 25% of the articles sampled had predominant racial or ethnic minority participants or globally underserved populations. So even though a big sample size, 271 different, there's just not enough research being done. And we have gained, that's the good part. But I think that what it really highlights is there's a lot more research that needs to be done in this area, and to really put the amplification, if you will, and some big horsepower behind this area, because it is important. And it made me feel good that it was done, but it was bittersweet because it just came up short. And, that I think puts a highlighter on the fact that we've got to spend more attention and more time on healthcare disparities. And we need to make sure that that's in the scientific community. It isn't looked over, and oftentimes with academic research that can be, and we need to be able to go towards funding sources to be able to say, hey, let's make sure that this area is not ignored in the research.
Give us a website where we can learn more about the association and more about the journal and the Decade in Review as well.
Well, you can get a direct link to the issue on our Family Therapy Magazine website, which is at ftm.aamft.org. Then there is that association website, www.aamft.org. And we also have a Twitter feed that keeps everybody up to date on the AAMFT. That would be the Twitter handle.
Dr. Todd, it's been a pleasure speaking with you. Thank you so much for joining us here on Health Professional Radio.
Thank you so much for having me and for highlighting this area of work. It really is appreciated.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Tracy Todd, CEO of the American Association for Marriage and Family Therapy. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes. Listen in, download it, SoundCloud, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.